Hi everyone, my name is Skylar and tonight I will be discussing epilepsy with you for my conditions presentation. So first of all, what is epilepsy? And to briefly put it, it is a multifactorial neurological disorder and is characterized by recurrent seizures caused by a sudden surge of brain activity. The etiology of epilepsy is characterized into three different categories, being acquired, idiopathic, and genetic or developmental origins. The first etiology is acquired, which is when there is an identifiable structural abrasion within one's brain, such as cerebral infection. And something that can cause this is an open head surgery or having meningitis. Secondly is idiopathic, and this is when there are no neurological signs. And this actually explains for about half of epilepsy cases. So many patients are unsure of why they are going through this condition. And lastly is genetic or developmental origin, and there are actually 977 epilepsy-related genes. So the pathophysiology of epilepsy, once again, to briefly put it, is seizures occur due to the hyperexcitability and imbalance between inhibition and excitation. So there are two different seizures that may occur with epilepsy. The first one being a focal seizure, and this is when a seizure occurs on one side of your brain, and prior to the seizure, a patient actually may have what's called an aura. So in other words, they might have a feeling that they're going to have a seizure. And this focal seizure may cause a progressive march of muscle contraction on one side of the body. And during this time, an individual can be aware or unaware. And when they are unaware, they become extremely disoriented. And secondly is a generalized onset seizure. And this is when both hemispheres of your brain are being impacted by the seizure. And this can cause stiffening of the muscles, muscle contractions, and or loss of muscle control. So here's just a visual to kind of give you an image in your head on what a focal versus generalized seizure can look like. In the clinical course for epilepsy, it starts off with 2+ unprovoked seizures. And this is when you want to head into your diagnosis process. And during this time, neurological tests and blood exams are done. And from there, if you are diagnosed with epilepsy, it goes into choosing a treatment option. And after you receive treatment, you continue monitoring yourself. Symptomology of epilepsy. So as I just mentioned, the biggest diagnosis indicator is 2 or more unprovoked seizures. And some temporary symptoms that happen during a seizure are loss of awareness, disturbances in movement, and a sensation, otherwise known as the aura that I just mentioned. And some long-term impacts of epilepsy can be developing psychological conditions such as depression or anxiety, and also having physical problems such as fractures that arise from the seizures. So the prognosis can depend on numerous factors, therefore the patterns are not static. Some of the factors may include one's age, the type of seizures that are occurring, and the number of seizures that are happening. And the etiology is the biggest predictor of prognosis. So for a genetic etiology, the remission is greater than an acquired etiology remission. And up to 70% of patients with epilepsy can actually live a seizure-free life. However, they are at a higher risk for premature death. So here are a couple treatment options. The most common one today is anti-epileptic drugs, also known as AEDs. And they may cause side effects within individuals, such as uncontrollable shaking and or lack of energy. Somebody may choose to have surgery to remove the portion of their brain that is causing the seizures. A ketogenic diet was actually the most common treatment option for epilepsy prior to AEDs. However, a ketogenic diet can actually cause other health problems like diabetes, but this type of diet helps control seizures by balancing one's hormones. So I read that this might be a better option for children if parents feel uncomfortable giving their children medication at such a young age. And lastly is a vagus nerve stimulation, which is when a small electrical device is placed under your skin and your chest, and bursts of electricity are sent from it, and it's thought to control seizures by changing the electrical signals. So the role for occupational therapists, the biggest one is safety, and we can do home modifications. So we can go in and review our client's home and make sure that their house is safe in the case that they do have seizures. We don't want to have any extended injuries from it. And we might also do safety training to make them aware of things that they may not think about, or help them understand what can that they can do to be safe. And we may also offer assistive equipment such as helmets with padding. And because of the psychological impacts that can arise from having epilepsy, we may also teach coping and self-management skills. And lastly, we can help them work on fine motor skills. So as I just mentioned, AEDs may cause tremors, so we can help them adapt to their tremors and minimize the impacts that it has on their everyday life. And lastly, for my community support, I found the Epilepsy Foundation, and this has been around for over 5 decades, and their main goals are to fund innovative research, educate the public about epilepsy and seizure first aid, and connect people to treatment, support, and resources. And on their website, I found 3 different resources that they provide, which are links to parent support groups and teenage support groups. They also have a 24/7 helpline and epilepsy centers that can connect an individual to a specialist for diagnosis and treatment options. And here are my references. Thank you for listening and have a great night.